Hello, everybody, and thank you so much for joining me this evening on a very important topic. In fact, this is kind of central to my practice and my life, which is functional medicine. How we use functional medicine to treat chronic illnesses. How is it different from conventional approaches? We want to get to the root cause because it's all connected. And kind of another simple term for functional medicine is becoming commonly known as root cause medicine. So let's get started here. I'm going to start by introducing myself. I'm Dr. Hirani. I did my residency and board certification in family practice in Michigan. After that, I practiced for some time in a traditional family practice office. In fact, I started my career in geriatrics in a family medicine office where I would treat the elderly with multiple health issues, multiple medications, and only 15 minutes to get everything done. So it was frustrating to me as the doctor. It was frustrating to the patient that was coming in with certain health problems. And of course, I didn't have time to devote enough to them to really overcome the issues that they were looking for. Anyway, that's when I started switching over to functional medicine. Um, I try to combine the best of both worlds. I use traditional medicine when absolutely necessary. My approach is to combine the best of both worlds, use functional medicine where we really try to look for the root cause, see what's going on in the body, and bring the body under better balance. Okay, so let's get started here today. And by the way, this is being recorded. You all will be getting a recording. You will see a chat box on the screen. Please feel free to chat your questions as you go and as they come to you. I will spend the last 15 minutes or so addressing everybody's questions. Thank you. All right. So if you look at this graph over here, you can see that healthcare in the United States is about twice as expensive as it is in any other developed country. Even with all the money that we spend on healthcare, the US was ranked last among the top 10 industrialized countries in overall health measures, mostly measured by length of life and quality of life. So, why are we paying so much more for healthcare and not appearing at the top of the rankings? Well, there's many reasons, but one of the reasons is that the US healthcare system spends a lot of time and money dealing with insurance administration. So reason we're more focused on sick, another reason is that we're more focused on sick care rather than preventive care. Insurance, unfortunately, at least most of the time, does not cover wellness. So we kind of ignore our health and symptoms and we wait for disease to progress. Well, as disease progresses, restoration of health and function becomes even more expensive, if not expensive in some impossible in some cases. There's a lot of financial burden associated with chronic disease, which contributes huge proportions to our healthcare costs. In fact, the National Academy of Sciences found that among other high income nations, the US has a higher rate of chronic illness and unfortunately a lower overall life expectancy. So, holistic medicine, it's a question of balance, the whole patient. Chinese medicine, again, balance, the yin and the yang. And then, unfortunately, a lot of conventional medicine is managed care medicine. What's covered, what versus what's not. Even some of the best of the doctors out there that really want to kind of get to the root and do more things, they're very limited by what insurance allows versus does not allow. And that's an extremely limiting factor, unfortunately. So let's talk a little bit about prescription medications, some of the statistics. 66% of all adults in the US use prescription drugs. Data suggests that among those who take prescription medications, the average number is about four, and that's pretty similar to what I see in my practice. And a lot of my practice, patients come in to me because they want to get off of some of their medications, and that's definitely something we work on. Research on prescription drugs spending suggests that the US consumes the most prescription drugs in the world. You can see some statistics right there in 2019 and probably more now. The US reported per capita spending of over $1,000. Canada was 879, Switzerland almost 900, and France 671. An interesting slide I thought I'd put in here, the top 10 drugs prescribed in the US. And one of the reasons I shared this slide is because you can see that most of these conditions that people are using prescription medications for are very preventable, are very treatable, okay? With lifestyle measures, a lot of these. Now, in some cases, yes, it truly is genetic, but in many of these cases, these are preventable conditions, right? Cholesterol medications, blood pressure medications, pain, acid blockers, anxiety, antidepressants, etc. So the question becomes, is medication the problem or the solution? Now, don't get me wrong, there's definitely a time and place for prescription medications. These can be life-saving, they can help people get their life back, and even necessary for a lot of people. And I prescribe medications all the time. But in my opinion, there's something fundamentally wrong if we base our entire healthcare system entirely on medication treatment. In my opinion, it shouldn't be the first approach, it should be the last approach, right? Have you tried everything to actually fix your health? And then you move on to medications. And we'll talk a little bit more about all of this as we go here. The problem with medications is that they rarely address the underlying cause of health issues. Many times they're masking the symptoms and therefore actually suppressing body functions, potentially worsening a problem over time. Let's take a very common medication like a acid blocker, for example. Acid blockers are used to treat acid reflux, again, very commonly used medication. The problem is it's actually reducing your stomach acid level, and we need high stomach acidity. The acid in our stomach is hydrochloric acid, a pH of 2 or 3, and that's necessary to help us digest our food and nutrients. So, if we're constantly or chronically over years taking a medication that's going to lower our stomach acid, we are actually reducing our overall absorption of nutrients, which can lead to other health issues. So, from a functional medicine approach, we want to try to figure out why you're having stomach acid issues, and let's try to fix it through lifestyle, through supplements, etc. Many times, medications, as just mentioned, will often correct one imbalance and cause others, resulting in side effects. And many times, unfortunately, the side effects outnumber the intended effects, especially over time. It's lifestyle medicine. Lifestyle medicine. So, there was an EPIC study published in a journal which studied 23,000 people's adherence to four simple behaviors. One, don't smoke. Two, exercise 3.5 hours a week. Three, eat a healthy diet. And four, try to keep a healthy weight. People that adhered to these four simple changes, there was a significant risk reduction of multiple health conditions, as you can see on this slide over here. Over 80% of illnesses are driven by our behavior and by the environment. Now, it's not easy. It takes commitment, motivation, strategy, change our habits. I totally get it. But we do have the power to prevent or reverse chronic illnesses. Now, functional medicine practitioners and health coaches can really help to support this process. What are some of the side effects of lifestyle medicine? Weight loss, increased energy, better mental clarity and focus, improved sleep and well being, reduction of risk of other diseases, and increased longevity. Hey, I'll take those side effects. So, what are some definitions of health and wellness? The WHO defines health as a state of complete physical, mental, and social well being, not just the absence of disease. The definition of wellness is an active process through which people become aware of and make choices towards a more successful existence. So, can we influence our health? Do we have a choice in preventing certain conditions or even reversing certain conditions? What if you can determine the way you age, or you can move beyond comfortable in your health and therefore your overall status? Because the healthier you are, the happier you are. Well, guess what? You can. You can make a difference. So, functional medicine addresses underlying causes of chronic diseases. A lot of these are rooted in lifestyle choices, environmental exposures, and genetic influences. Functional medicine asks the questions how and why illness occurs and restores health by addressing those root causes. I kind of like calling ourselves health detectives, right? We really kind of act like a detective to try to figure out why something is happening. Not always easy, but we have to keep working at it. And then also, it involves creating a personalized therapeutic plan for each unique patient using a science based approach. Dr. Mark Hyman, who's the father of functional medicine, he quoted, "Functional medicine is medicine by cause, not by symptom. Functional medicine practitioners don't, in fact, treat disease. We treat your body's ecosystem. We get rid of the bad stuff that don't belong. We put in the good stuff that do belong. And because your body is an intelligent system, it does the rest. Believe it or not, our body does know how to heal. In fact, it's constantly trying to heal. We just need to support that healing process. So, doctor and physician are outdated terms. I'm your biological tech support specialist. So, I wanted to, you'll see that I've given several analogies over here because many times I think analogies are some of the best ways to understand what's going on. But the analogy for functional medicine that I give people is suppose you've got a thumbtack stuck somewhere in your body, right? And now you're in pain and and it's constantly hurting you. Well, there's two ways you can treat it. You can keep taking Tylenol, Advil, or other pain medications, right? And keep dampening or suppressing the pain, or you can try to remove this thumbtack. That's the difference, right? Treating symptoms versus treating the root cause. Well, your health is like a tree. The leaves and branches represent your symptoms like fatigue, headaches, skin issues, joint pain. So, in a traditional medicine approach, we trim those leaves, we treat the symptoms with medications. We basically just treat or manage what we can see, what's visible, right? That's the branches on top. Functional medicine goes deeper. We look beneath the surface to the roots of the tree. That would be things like your gut health, nutrition, environment, sleep, your genetics, your emotional well being. The roots is what nourish the tree. And if those roots are diseased or imbalanced, symptoms are going to keep coming about. So, for example, if you've got high blood pressure, sure, we could give you a medication to treat the blood pressure. And many times we do have to. I prescribe blood pressure medications commonly myself. But functional medicine approach might ask, why is the blood pressure high? Is there stress? Is there insulin resistance, poor sleep, inflammation? What's causing it? And if we can find that root cause and treat it, guess what? We're actually fixing the blood pressure than trying to cover it up with the medication. And even if you do need to go on medication initially, because it's important to keep that blood pressure stable, as we work on the root cause, we can at least try to remove the medication. That's where we see kind of that integration of conventional and functional medicine. So this is pretty interesting. You'll see, with root causes on the left there, you'll see you can have one condition and there can be many causes. So if two people walk into me with depression, one of them, it could be because of an omega-3 deficiency, and the other person could have hypothyroidism. And then on the right side there, you can see there could be one cause which causes many conditions. For example, inflammation can cause depression, heart disease, cancer, arthritis, etc. Right? So again, that's where a lot of this detective work comes into place. Here's an example. Both of these women on this chart have an autoimmune condition. But in the first woman there, the cause of her autoimmune condition is poor gut health. The drivers of her poor gut health are food sensitivities and stress. So we put her on a gut healing protocol, elimination diet, manage the stress, and we might be able to treat her autoimmunity. And in our second patient there, her autoimmunity cause is a viral infection. And what drives a lot of that or prevents it from being healed is high sugar intake and poor detoxification. So we treat her with antiviral treatments, blood sugar management, detox support, and we might be able to treat her autoimmune condition. Okay. So again, it's not one condition for all. On this slide, I'm not going to go over each of these points, but you can see these are some of the most common core imbalances and dysfunction which drive all disease. The other example I gave, the tree with the roots, this is the iceberg with the tip of the iceberg on top. So in a functional medicine approach, we take a very detailed history and health assessment. Your new patient appointment might be at least an hour and a half, really getting into the details, your birth history, your childhood health, what's going on, and your future health goals. And then we use specialized lab testing where we're actually testing your nutrients, your hormones, your gut microbiome, food intolerances, genetics, and other things. Based on all this information, we create a personalized lab-based supplement protocol. We do use prescription medications if appropriate and necessary, and of course, targeted lifestyle changes. So in functional medicine approach, I listen, I hunt for clues in your story that link to your health. Then I add your story to a wealth of additional information from advanced labs, diagnostics. I process everything I've learned from you, and your testing. I share my findings with you, as well as recommend personalized lifestyle recommendations, which I highly recommend working with a health coach to help implement and support those process. This allows us to work together to solve the puzzle of your health and formulate a plan to help you achieve your own vision for health. It's very important. This partnership in functional medicine is very important because it's this reorientation of our relationship from I'm the doctor, you're the patient, do as I say and I'll fix you, to instead, I'm an expert in functional medicine, you're an expert in you. Let's work together and therefore take you where you want to go. And that's when you really begin to see change and impact on your health and therefore your life. I do believe education is a large part of this. The more you understand what's going on with your health and why it's happening, the better your ability to heal. I look for what I call the aha moment in my patients when suddenly they grasp that, oh, no wonder this is happening, right? And I think I can fix this. Beautiful moment. So, functional medicine, it's a myth. A lot of times people believe that traditional medicine is evidence based and functional medicine is not. Well, I can tell you, if a functional medicine clinician tells you to avoid gluten to improve your thyroid health or to take berberine to lower your blood sugar, it's because there is definite research that supports that connection. All right. So, for example, how is gluten connected to hypothyroidism? Well, especially in Hashimoto's hypothyroidism, gluten, the structure of gluten, as you can see on the slide there, is very similar to the structure of thyroid tissue. So, in a condition of molecular mimicry or mistaken identity with the immune system, what starts to happen is every time, if your body is gluten insensitive, every time your immune system sees gluten, it starts to attack gluten. Well, it thinks the thyroid is also gluten. And it starts to attack the thyroid along with that gluten. And that's why in about 80-90% of people that have Hashimoto's hypothyroidism, they may have a gluten intolerance. And once they eliminate the gluten, immune system stops attacking the gluten, stops attacking the thyroid tissue. You feel a lot better. Okay. Again, root cause medicine. I'm not going to go over, all of these, but these are just some examples of some research studies. And, the first one in particular, I think is pretty interesting. It's been found that 10 to 30% of depressed patients may have low folate concentrations. Those are the people that take, antidepressants and don't really seem to respond well to them. Well, they may have low folate levels. And once we identify that and take folate, we may just with that alone be able to help to cure the depression or improve the efficacy to the medication. Yes, garlic and herbs can improve your cholesterol, but not garlic and herb potato chips. Again, remember this is being recorded. Everybody will be getting a recording. And then also, uh, please feel free to type in any questions in the chat box as we go along here. I will take time at the end to address them. All right, so how do we achieve functional body balance? Well, my belief is that most symptoms are due to hormone imbalance. The most common cause of hormone imbalance, why do they go off balance, is inflammation. Why do we get inflamed? Some of the most common causes of inflammation are poor diet, chronic stress, toxins, or chronic infections. So that's part of our detective work to look for these things. So let's start by talking about hormones. How do hormones influence our health? Well, hormones are chemical messengers. So think of hormones in your body like mail carriers or messengers, okay? The hormones are created in special post offices like your thyroid gland or the adrenal glands or the ovaries. Those are the post offices. Once released, they travel through your bloodstream like roads or delivery routes to deliver specific messages to target organs or cells. The messages may say the following. The thyroid may say, hey, body, start burning energy. Cortisol may say, hey, body, raise blood sugar. We're under stress. LH and FSH hormones may say, hey, ovary, release an egg. Estrogen may say, hey, bone cell, start building yourself. Insulin may say, hey, body, store the sugar. And melatonin may say, time to relax and sleep. So, again, these are messages given by different hormones. And just any good male system, timing, accuracy, and delivery really matters. So, if your hormonal male system is not working properly, you run into trouble. You get symptoms. For example, if messages are delayed, you might feel sluggish, foggy, or fatigued. Maybe the message doesn't get delivered at all. Your cells stop responding, for example, insulin resistance. Maybe there's too many messages all at once. You feel anxious, inflamed, overwhelmed. Or what if it's the wrong message altogether? Your body gets confused about what to do. So, functional medicine, again, we ask those questions. What's going on? Why are the hormones out of balance? Is the post office or the gland being overworked or under functioning? Are the roads, which is the blood flow detox pathways, clear? Are they congested? Are the recipients, which are the cells, are they responsive and healthy? Once we identify this information, we can restore your body's communication systems so that everything starts functioning in harmony again. Endocrine hormone optimization basically includes balancing four major hormone groups, as mentioned on this slide. Common symptoms of hormone imbalances, as you can see here. How do we know if your hormones are out of balance or what is going on? Hormones like Goldilocks, they can't be too low, they can't be too high, they've got to be just right. So we don't have to guess, we can test. So as seen on the slide, this is a sample report. On the top there, it's looking at, you can see low progesterone levels in this particular patient. And then right underneath that, we see very high estrogen levels. So this person's got, imbalances. So how do we fix these? Well, whatever's too low, we want to raise it. Whatever's too high, we want to reduce it. And we do these through targeted supplements, targeted lifestyle changes, and medication when necessary. All right, so that was phase one, hormones. Phase two, gut restoration. Functional medicine principles are deeply rooted in healthy gut. In fact, it's almost impossible to have a healthy body if you don't have a healthy gut. Gut restoration includes gut microbial balance. That's our microbiome. Our microbiome's got trillions of bacteria, which have an important function and role as if it's its own organ system. Okay. Detox, repair. Hippocrates, which was the father of modern medicine, he said all disease begins in the gut, and functional medicine principles still believe in this. In fact, over 40 different diseases have been linked to bacterial imbalance in the gut. So the digestive system is the foundation of all health. You've probably all heard of the phrase, we are what we eat, but really it goes beyond that. We are what we eat and absorb. So it's not just about healthy eating. Are we utilizing the nutrients from the food that we're eating? Are we digesting properly? Are those nutrients getting into our cells properly? Okay. So the digestive system provides that nutrition for all the cells in our body. It plays a critical role in our immune system. A sick digestive system, one that's irritated, inflamed, can't do its job properly, resulting in chronic and degenerative diseases and a steady decline in health and well being. So, another analogy here, think of the gut as the central command center of our body, like kind of mission control at NASA, right? So, it's a central command center that gathers, processes, and sends critical information to every part of our body. So the food you eat is like incoming data. It needs to be broken down, digested, sorted, and then sent to the right cells, to the right body systems. Your gut microbes, all that good bacteria in there, are like engineers and technicians. They analyze whatever nutrition is coming in, they make vitamins, they fight off invaders, any bad guys that are coming in there, and they maintain a lot of that healthy gut lining. It's constantly communicating with other key areas. It communicates with the brain via the vagus nerve, communicates with the immune system. In fact, 70% of our immune system is in the gut. So, a lot of autoimmune conditions, for example, can begin in the gut as well. It communicates with our hormonal system, communicates with our skin and mood. So, a lot of skin conditions like eczema, for example, might be due to an inflamed or leaky gut. Um, so if these signals get crossed or delayed, we can have mood swings, fatigue, brain fog. If a lot of those toxins build up because we're not fighting off the invaders, we can have skin problems, inflammation, joint pain. If the immune system gets confused, we can develop hyperallergies, autoimmunity. And again, if you're not processing those nutrients properly, you feel depleted no matter what you eat. Everything downstream suffers because that mission control is offline. So with functional medicine, we reboot that system rather than only treating the symptoms like, oh, you've got stomach acid issues. Let's give you an acid blocker. Let's figure out why. Let's reset that gut microbiome. Let's heal the gut lining. Let's improve your ability to digest and absorb your nutrients. And let's optimize that communication with other organ systems. You can see over here, your gut microbiome again affects so many different conditions in the body. And really, it's this is just a small slide. It's a lot more than this that's being influenced. Again, our gut microbiome should be 80% good bacteria, also known as probiotics, 20% other bacteria. You can see on the slide the good bacteria maintain healthy lining and they keep away those disruptive, harmful bacteria. The bad bacteria leak through, causing toxins, inflammation, and affects poor immune health. And how do we know? Tests don't guess, right? We can actually check what's going on in your gut. You can see on this slide, this is again another sample report of kind of looking at five categories of function in your gut there on the left side. You can see, it assesses how are you digesting food? Are you making enough enzymes or stomach acid to break up and digest your food properly? If not, let's give you some enzymes, right? It looks at how much inflammation is in your gut. Maybe you're eating foods that are inflammatory. Maybe you've got too much gut bacteria and your immune system is fighting against all of that, constantly triggering an immune response and inflammation. The third category is their dysbiosis. Do you have the right balance of your good and bad bacteria, right? Maybe you have too little of the good stuff and too much of the bad stuff. It looks for leaky gut, damage to the gut lining. Do you have enough fuel for healthy gut lining function? And finally, it looks for any infections. Do you have too much bacteria, parasites, yeasts, or candida that have overgrown in there, causing issues? And then the right side there is kind of giving us an idea of your microbiome and the different probiotics and their balance to each other. So in functional medicine, we follow something called the 5R program for gut health. You want to remove offending substances, as mentioned there. You want to re-inoculate, in other words, put back in the good stuff, probiotics, prebiotics, replace any kind of missing digestive enzymes, bile salts, stomach acid, repair that gut mucosal lining, and then rebalance with nutrition, hormones, sleep, and lifestyle. Just high stress can damage that gut lining. It may not have anything to do with what you're eating. Okay. So that rebalance or fifth category really does matter. All right. So we talked about phase one, hormone balance, phase two, gut, and phase three is ongoing, which is addressing inflammation by eating clean, organic, whole food based, anti inflammatory diet, real food. Okay. Food that nourishes our body. You want to address stress. You want to work on a deep restorative sleep, exercise, movement, and reduce toxic body burden. Food is powerful. It's one of the most powerful substances we put in our body. It can, if we put the wrong stuff in, it can trigger inflammation and disease. But if we put the right stuff in, it could be medicinal, okay, and create lifelong health. So when we eat those nourishing and healing foods, we can reverse progression of multiple health conditions. Fewer symptoms, feel better. Again, every bite put into our mouth has the potential to heal our body. Another analogy here. Think of the body as a massive construction site, okay? Your cells are the workers, which are constantly repairing, replacing, building tissue, enzymes, hormones, immune defenses, etc. So think of healthy food like the raw materials. Those healthy foods, your vitamins, minerals, amino acids, etc., those are like the bricks, the steel, the wiring. Materials are high quality, the workers can build strong, efficient, and durable structures. Those structures are your organs, your bones, your muscles, right? So healthy nutrients, healthy organs and tissues. However, if you're feeding the site junk material, ultra processed foods, excess sugar, low nutrient foods, those workers are left with weak and missing supplies, leading to poor repair, slow progress, and structural instability. So if you don't have those right building blocks, even those most skilled workers, which is your body's natural functions, can't do their job effectively. Okay. So again, nutrition really does matter. I'm not going to go over all the details here, but I did want to give some slides over there on just some guidelines on healthy, nourishing foods and what to avoid. Sensitivities, just a little word over here about food sensitivities. You can be thinking sometimes that you're eating healthy foods, like an apple a day keeps the doctor away, right? But in your case, if that apple is a sensitivity or an intolerance for you, it can actually trigger an immune response, creating inflammation and neurotoxicity. And you may be thinking you're doing the right thing, but maybe you're not, not of your own fault, but you have developed this food sensitivity. Okay. And digestive symptoms can occur with food sensitivities, but it's not always the case. So, in other words, if you have a food sensitivity, you don't have to have gut symptoms. You may not. In fact, common symptoms of food sensitivities are more systemic disorders like fatigue, sleep issues, hormone disruptions, mood disorders. Okay. Food sensitivities can sometimes be hard to identify because symptoms may not show up right away. You ate that apple today and maybe you're reacting to it 2 days later. Okay. Or you can develop it right away. And those are the more easy ones, or, those you can identify right away. So, why do we get food sensitivities, or how do they cause problems in the body? Think of it as an overflowing sink. Your immune system is like a sink, and every food sensitivity, so every food you eat that for you is bad, it might be good in general, but for you it's bad. Every time you eat that food, it's like you're filling the bowl. Okay. That water, each drip of water is filling the bowl. Eventually, when that overflows, you get all of these symptoms that you're not necessarily connecting to the food. So you kind of have to have enough of a threshold of that food to actually develop symptoms from it sometimes, unless they're more immediate reactions. You can see that can cause various symptoms over here. So, what do we do? Do we just mop the floor when all that water is overflowed? No, we turn off the faucet and we clear the drain. The drain might be a backed up or clogged up liver, gut, or detox systems. So we want to open up those detox channels, open up the drain, stop the dripping, clean up the sink, and eventually, most people are able to add those sensitive foods back in without a problem, as long as you fix the reasons why that began to begin with. So you want to identify those, you want to heal the gut, and you want to support natural detox processes. So again, how do you know if you have food sensitivities? Well, there's two main ways. One is testing. Okay, you can definitely do some tests. There's various tests out there to help you understand that process. Or two, something called an elimination diet, where you remove some of the most common food sensitivities from your diet for a period of time, 3 to 4 weeks, and then you gradually introduce them back in every 3 to 4 days, maintain a diary or a log, and try to assess what's going on. Sometimes people will find that when they do the elimination diet, they feel so much better. And then when they start to add the foods back in, they have a problem. And sometimes, again, it's easy to tell what food that is. Sometimes it may not be as easy. Okay. So, again, pluses and minuses, very cheap to do, of course. But, sometimes it might not be easy to tell exactly what's going on. And of course, you can do testing, pluses. Some of these tests can be pricey, but it does give you exactly, as you can see over here, which foods you are intolerant to. Most of the newer tests these days have about a 90 to 95% accuracy rate, which is pretty good. Some of the older tests weren't quite that accurate. And these tests can tell you which ones are severe food intolerances. Now, these are not the same as allergies. Food allergies are more easy to identify. You eat a food and you get just a definite allergic reaction. Food sensitivities or tolerances are different. Okay. They cause these sort of vague symptoms, fatigue, brain fog. You don't really know. Okay. Until you eliminate the food. So, what are some practical tips? Eat real food. Unless you have specific food allergens, there's nothing you can't eat. It's a matter of moderation and balance. Remember, perfection is the enemy of progress. So don't try to be perfect with your lifestyle, with what you eat. Just be consistent. Consistency is the key. 80% of the time, try to eat well. And as long as you can maintain that consistency, you can do pretty well. Okay. The most studied dietary food plan out there is the Mediterranean diet. That's usually the one, if you wanted to start somewhere, that would be a great place to start. You want to make sure you eat a balanced diet, get all your macronutrients and micronutrients, lots of phytonutrients and vegetables and things like that. Of course, if you're having gut problems and you're having trouble digesting some of these foods, maybe your digestive system has to be fixed before you can eat healthy, right? So it's kind of a combination. Both are necessary. Work on both sides of the fence, as I call it. Julia Ross, she kind of put out some practical tips called the ideal plate, which I think can be very helpful. What she said is make protein a quarter of your plate, which is about the size of the palm of your hand. Low carb vegetables should be more than half of your plate. High carb veggies, grains, legumes, maybe a corner. Make sure you get your healthy oils or fats as your flavorings. Begin your meal with those low carb vegetables and protein, and then end your meal with the high carb section. This should take the edge off your appetite, reduce that excess interest in the higher carb section, because by the time you get there, you're not as hungry and gulping it down. Lose some weight, quit smoking, move around more, and eat the carrot. Some more practical tips about exercise, right? Obviously, we can't forget exercise, such an important lifestyle um, bonus, absolutely necessary, you know. Um, everybody tries to get that exercise in. And a lot of times people think, oh, I've got to do an hour. I've got to do all this time at the gym. I have to go there. I have to make time. In our busy lives, we don't always get that time. And if you do, great, more power to you. And if you don't, there are other ways you can get around it. Dr. Antoinette Yancey actually did research and said even brief bouts of moderate to vigorous physical activity in tiny bits, as brief as 3 to 5 minutes at a time, can be extremely effective. And she demonstrated valid data to prove it. So the biggest thing is movement, stay active, go up and down the steps, walk in the parking lot. And, during those 3 to 5 minutes, try to make it aggressive exercise, according to what's doable for you. So split into mini sessions through the day. Find ways to make it blend into your day so that it's a part of your day. So maybe instead of taking a break and sitting, take a break and walk. Take a fitness break at your next meeting. Okay, take a walking meeting with one or two others, that sort of thing. And then, one thing that's become a little bit more popular is, people getting these little sort of stationary pedals under their desks and just pedaling under your desk, right? So find ways to incorporate movement into your lifestyle. Another little cartoon there. You have to actually exercise. Jumping to conclusions, stretching the truth, skipping breakfast, and juggling two jobs won't do it. So, sleep and health. Sleep, obviously, also very important. Without sufficient sleep, the body makes fewer cytokines. That's the protein that targets infection, inflammation, and therefore the body can't really fight viruses or bacteria very well. Research clearly shows that lack of sleep or poor sleep damages your metabolism, increase cravings for sugar and carbs, therefore you want to eat more, and drives your risk of numerous conditions, cardiovascular disease, diabetes, autoimmunity, etc. While we sleep at night, believe it or not, the body's quite busy. There's a lot it's doing in there that we don't even realize. It repairs itself, it releases toxins, it rejuvenates, so that ideally you should wake up feeling renewed. 7 to 8 hours of sleep is recommended. Everybody's different. They may have different amounts, but majority of people do need about that much. If your sleep schedule is interrupted, feel free to make up for it by taking power naps in the daytime. That research has also shown that that can be very beneficial. So if you're sleep deprived and having issues due to it, take those power naps in the daytime. That's been shown to offset the negative effects of sleep deprivation on the immune system. There's nothing wrong with power naps. All right. Stress. How does stress affect our health? So, another analogy here, I promise this is the last one. Imagine your body's a building and your nervous system is equipped with a smoke detector and a sprinkler system designed to keep you safe in emergencies. So, when with short term stress, which is a real fire, with that true emergency, like a tiger chasing you or a car swerving towards you or something like that, the stress response is needed, necessary, perfect, and can be life saving. That's why we have the stress response to save our lives, survival, fight or flight. Okay. So what happens? The alarm sounds, your brain triggers something called the hypothalamic pituitary adrenal axis. Okay. These hormones then release a bunch of stress hormones like cortisol and adrenaline, which flood your system. All right. So that causes the blood to go to your muscles and brain, and it causes various different chemical reactions that need to occur in the body to prioritize survival. Okay. It's like the, building going into emergency mode to help you escape the fire. What happens though if you have chronic stress? Now that's not such a good thing anymore. In this case, that alarm doesn't shut off, especially in our modern life. And in our modern life, that fire is not the tiger, it's emails, traffic, finances, arguments, lack of sleep, deadlines, etc. And suppose that alarm keeps ringing all day long, every day, even though it's not a hugely loud alarm and just a mild alarm, but it's constantly turned on. That can't be good for our body, right? What happens? Well, your body stays in a constant state of alert. Sprinklers soak up everything, over time causes wear and tear. Your digestion slows down. Hormones become imbalanced. Immune system becomes erratic. You feel tired but wired, inflamed, moody, bloated, burnt out. It's not fun that's causing the damage, it's the unrelenting alarm. Okay. So in functional medicine, we want to reset that alarm system. So instead of just masking the symptom, like silencing the alarm without stopping the smoke, again, we want to ask those questions. Why? What's triggering the alarm? Is it your workload, blood sugar, trauma? Are your stress hormones, cortisol, adrenaline, et cetera, out of balance? How can we support your resilience naturally? So even though maybe a particular stressor is causing high cortisol and bodily changes, maybe as we improve your body resilience, that same stressor won't cause the same negative response in the future. So we want to teach the body how to feel safe again. Healing, energy, digestion, joy can return. Cortisol, DHEA is some of our main adrenal stress hormones. You can see on the slide, regulates or controls so many different processes in the body. So obviously, if those cortisol levels or DHEA levels are out of balance, remember what I said before, hormones like Goldilocks can't be too high, can't be too low. They've got to be just right. So if it's out of balance, too high, too low, it can cause various different health conditions. So the most important part of stress is how we react to it. Our body works better when we perceive a sense of control over our stress. Okay. And that's why daily stress reduction techniques really do matter. Okay. It's not easy, but very important to manage stress in our lives. These practices can help decrease the severity of existing diseases and even reduce your risk of developing long term conditions, including autoimmune conditions. Very important to seek out, to actively seek out love, community, connection, meaning, and purpose. This takes work, effort, time, but find a partner, find someone that can partner with you in this healing journey to look for these things because it can make all the difference in your health and therefore your life. Mindfulness has been shown in multiple research trials to control cortisol levels and really can help bring down generalized inflammation as well. You want to identify sources of chronic inflammation. Okay, so again, those chronic hidden gut infections, severe acute trauma or injury, toxin exposures, and other conditions, and many of these we've already talked about. Toxins also can play a huge role. I mean, if too many of these toxins come into our body, they damage our cells over time, essentially. You know, our cells just don't know they're not repairing appropriately. And again, they don't do the job properly or appropriately. All right. And it's fine if, our body has our own detox systems, our liver, our gut, our kidneys, et cetera. And we're supposed to be constantly detoxing, but and again, in our modern world, we are exposed to so many more toxins than ever before. And we get our body, our detox channels, our drains get plugged up, clogged up, overwhelmed. And then the toxins tend to build up, causing damage and dysfunction. Some of the greatest exposures come from the foods we eat, the water we drink, the air we breathe, and the personal care products we use. Now, unless we go in the Himalayas somewhere, we're not going to be able to escape toxins. It's not even practical to be able to get away from 100% toxins. But whatever is under our control, whatever we can control, is very important because even if we reduce 20, 30% of that threshold, we can still make a big difference in our body. Okay. I do separate talks, by the way, or webinars on all of these topics on detox, on stress management, hormone balance, the gut, etc. Okay, so I can't go over everything, of course, on this. We'll be here for a couple of days, but please feel free to tune in to some of the other webinars if you're interested in any of these conditions specifically. Another little cartoon there. Do you also eat with that mask on? All right, so the trick is not to be perfect, as mentioned before, but practice doable and regular healthy habits. Consistency is key. Make it all a habit. Build health resilience. Once balance has been restored, you've worked on the functional medicine approach, removed things that don't belong, put in things that do belong, and you've restored that balance. Your next goal should be to maintain that balance regardless of future stressors. What is resilience? It's the ability to go out into the world and bounce back when faced with things that may have made you sick in the past. And that's where, we build resilience with a healthier body, healthier cells, healthier tissues and organs. When we are resilient, we get sick less often, recover more quickly, become less susceptible to infection, allergens, and sensitivities. Again, the ultimate goal is to stay well, rather than simply feel better when the body feels unwell. That's what functional medicine and lifestyle medicine and preventive medicine, really kind of all in the same category, is about. So it's up to you. You can make that choice. What will you choose? So thank you so much. I know there was a lot over here, and hopefully, the purpose of this webinar was to just give you an understanding of what functional medicine is, how we use it to address chronic illnesses, the functional detective work, to really kind of look into this. Functional medicine, as I tell all my patients, is a marathon. It's not a sprint. So yes, it takes time and effort, but the reward is ultimate healing, where you're healing from deep within and restoring your body back to a state of health and wellness. Okay. So thank you so much. You've been a wonderful audience. You can see on this slide, we have some of our contact information. Please feel free to contact us with any questions, concerns. Like I said, you will be getting a copy of this presentation soon, within the next week or so. But if you have any other questions, please feel free to reach out to our office. I would love to answer those questions, either me or my staff. Thank you so much again. Have a wonderful rest of the evening. I will give you a few minutes. If you have any questions, please feel free to type them into the chat box. All right. So somebody asked, are individual sessions available? I'm not sure what you mean by that. We do typically, the way the approach looks like is, the physician sees you for initial new patient appointment. Like I said, spends a lot of time with you on that first visit, really gathering a lot of history and detail, et cetera. And then based on what you tell us, we start to already kind of think about what might be going on. And then we usually recommend certain specialized testing, like hormones or gut or whatever it might be. And then you come back for a visit two with those test results, and we sort of put your roadmap together. We put your journey together, what things look like based on your goals, based on what we see, et cetera. And then we, continue to do follow-up visits as we address those goals. Usually it does take about, again, depending on how complex things are, it does take about a year or so to really get to get through all these layers, these different sort of phases, et cetera, and get to where we want to get. And then we can go into a maintenance. Some people that are a little bit more complex, or things have been going on for a long time, it might take a couple of years, and then we maintain. We always work towards maintenance. So yes, it is an individual one-on-one, where, just the physician and you are, in that visit together. But we do also work with the health coach. So whatever lifestyle practices or recommendations are prescribed by the physician, then you work with the health coach who helps you to implement those. Again, as mentioned on the slide, there's kind of five lifestyle components. There's stress management, sleep management, detox and removal of toxins, um, diet, nutrition, exercise. Okay, so the health coach really kind of helps you support those processes. You're not alone in this. Okay. All right. Let's see some other questions here. Uh, what inspired you to practice functional medicine? Do you think more traditional doctors will switch over time? Wonderful question. Thank you for asking. What inspired me to practice functional medicine was actually health conditions in my own family. Uh, Definitely, I had a family member who underwent lots of different health conditions, and very, very difficult to get him back in those days. I was still traditional medicine, and I thought I did everything in my power to help him heal, and I couldn't get him to heal. So I myself consulted with a functional medicine physician who miraculously, made a big difference in the health, actually, of my child. And he is currently a very healthy adult. And that inspired me, and it changed completely the way I think about functional medicine and my practice, of course. So, yeah, I leapt right into this field, and it's been extremely gratifying to see people heal from within. A lot of supplements say, and the other part of that question, do you think more traditional doctors will switch? Well, it's already happening. A lot of doctors are making that switch. It is a very new field. I would say functional medicine still is kind of a baby in this world, but really, really starting to grow, which I'm just so happy to see. All right, next question. A lot of supplements say to consult with the health professional, but traditional doctors are hands off. I feel like at a loss with regard to where to go for guidance. Yeah, I get it. And supplement companies, of course, are supposed to say that legally because we don't want people using the wrong supplement and potentially make themselves worse. Even though supplements are natural, doesn't mean it's right for you or doesn't mean it's not dangerous if used inappropriately. So there is a certain guidance or a way to use the supplements in a very targeted way. So usually, again, if you really want guidance with some of those, your best bet is going to be somebody in the functional medicine field who specializes in supplements. And it's not just about, I mean, of course, that's important to take the right supplement for the right, condition, but it's not just about that. Unfortunately, a lot of supplements out there are not regulated. There's no company that's looking at them and even saying, "Oh, okay, you're right. You actually do have what you say on your label," that sort of thing. So it's not a regulated industry. So you could potentially be taking supplements that are actually harmful to you. So it's very important to take good quality and get, appropriate guidance. On some of my webinars, on some of the more specific topics that I talk about, I do give some suggestions for certain supplements and things like that. Of course, this was a very broad topic, more just kind of about functional medicine in general. But again, feel free to tune into some of those. But yeah, functional medicine practitioners as well as health coaches, would be your biggest source to help lead you to the targeted approach. Okay. Um, any other questions? All right. And then we have several thank yous. Thank you. Thank you for being a wonderful audience. I wish you all the best of health. Um, and, as it says on this fortune cookie here, good health will be yours for a long time. Take care and have a wonderful evening. Thank you.